Thank you, Marissa. Good morning again, everyone. Folks at the head table. Okay. Hi. It's my pleasure to give this talk. I was asked to talk about heavy-sounding topic, prioritization and resource allocation of regional governments in meeting Agenda 2030 goals. And do people know what Agenda 2030 means? It's the overarching set of development goals that the world has signed up to for everyone, not just rich or poor countries. Very quickly, the regional and international commitments to which we're signed up in the Caribbean are CCH4 and the SDGs. That's the two things to remember from this slide. CCH4 is Caribbean Cooperation and Health, Phase 4, and SDGs are those Sustainable Development Goals. And within the SDGs, there's a specific target for non-communicable diseases, which includes cancer, and where the Caribbean's leadership was really significant in getting that as an agreed global target. How does it work? Well, health and wellness is quite essential for development. We argue in the Caribbean, and the Caribbean Cooperation and Health Program, of which CARPHA is a major instrument, improves health and well-being and productivity, and you advance your national and regional development goals. Where are we now? Well, we have this slide tries to sum up. The region as a whole has about 40 million people. The CARPHA member states are 17 million, including Haiti. We're SIDS, small island developing states, very diverse in size, from 10,000 to 10 million, very diverse in language, but sharing vulnerability because of small size, because of climate, and so on. Climate is a big challenge for the region. I argue now that's the biggest public health challenge that the region faces. It's the other side of the coin to the other big challenge, the NCDs and demographic challenge that we have. We have still emerging and re-emerging diseases with our 50 million visitors a year. We have good education and communication. We have more cell phones than people. Why do half of the women in this country who were supposed to never had a cervical cancer smear? Why did that thought come into my mind? Well, surely we can partner with the cell phone companies to find a way to remind everybody to come and have it. The 2012 survey in this country showed that half of the women in a high-income country who have never had any kind of cervical examination. That's just not acceptable from my point of view. We need to work on that. Those are our major industries. We have an active process of regional integration and functional cooperation through CCH. The last phase of this thing, what it achieved, CARPHA was birthed. We had this famous Port of Spain Declaration on NCDs by our governments, our heads, which then led on to the UN high-level meetings. That's pretty good leadership. The problem is to keep it up, and that's partly what I'm trying to unpack today. How do you get that policy focus and get the resources and the partnering that's needed? We've run throughout this the lab services and networks for the region over the last years. The Health Research Council for the Caribbean over 60 years. That's a pretty good achievement. The formation of the Healthy Caribbean Coalition, the emergence of a stronger civil society movement. And your association is a civil society movement. It's a professional society. And one has seen over and over again in different countries and at different times what a big difference that can make if you get the advocacy of prominent folks, first ladies and so on, and the media and personalities, that's all part of the formula for getting the resources to do what we need to do. We know we're going through a demographic transition, and this is driving cancer and non-communicable diseases. Our economies cannot afford the amount of ill health we have in the working age population. They weren't set up like that. The World Bank, IMF published a report about just over a year ago about the imminent insolvency of Caribbean social security organizations. Because of this, fewer people are paying contributions from the base of the pyramid, and those in the middle are too sick. A lot of disability, early retirement, and so it really messes up the paradigm of economic development. This is happening all over the region except maybe Haiti. If you look at what people die from, the broad band in the middle, all the red, is the non-communicable diseases. We still have some communicable and maternal and child problems, but non-NCDs are the big ones. And if you look at this slide for a moment, the orange is the communicable maternal perinatal, and you'll see that's going to be at your youngest age. That green band so these are the 8 specific mortalities. So you can look at it from youth through middle age to elderly. And as you get older, you see the NCDs, but all ages have NCDs. But look at that purple bar. That's scary. That's a violence and injury problem. And you see the high levels of mortality so there's proportional mortality in the sort of 14, 15 to 19, 20 to 25, 30 to 34 age group. We're killing ourselves, and the rate at which we're doing it is 30 times that of the United Kingdom. This unpacks it in a different way. Non-communicable diseases present in all age groups. Number one killer for us, cancer, making up about 30% of the burden, about 40% of our deaths. We have about 16,000 deaths in the 30 to 70-year-old age in our region. I'm trying to cut that by a third, to put it in concrete terms. Trying to avoid 6,000 deaths a year by the time you get to the development target. If you unpack the cancer, females, you see the mortality profile here. It may not be so easy to see it from where you are, but you see the dominance of breast and lung and colorectal cancer of the cervix. Cancer of the cervix is a disease that ought to be targeted for elimination as a public health problem. Elimination as a public health problem through screening, education, vaccination, good treatment. There's no reason why we can't do it, especially in our islands. But first, people have got to get screened and get vaccinated. And if you look at the men, you see the dominance of prostatic cancer, lung again, and other. Colorectal, those are the big ones. Cancer burden, incidence, and mortality, and what is projected. And with the demographic shift, with the risk factors that are so abundant, that's why we're all here. This is a growing burden. And accompanying the burden is the cost burden. This is the overall Caribbean non-communicable disease scorecard, 20 countries, 26 indicators. This is monitored approximately annually by UWI and CARPHA. And there's a red band across the middle around the diet and nutrition area. And that's the area we've been really struggling with, and with consequences for NCDs and cancer. Heavy economic impact. Hard perhaps to see all that text. I'll jump ahead to this one, which is a graphic, maybe a little easier. This is here in Trinidad and Tobago, an Inter-American Development Bank study showing that the economic impact of cancer, hypertension, and diabetes was a few billions and about 4.3% of the gross domestic product, both in direct medical care costs and the indirect costs. And if you look at cancer, you see the high indirect costs because of the long periods of disability, others staying out of the workforce to look after you, and so on. That data is quite instrumental in this country, I think, signing a major grant to improve chronic disease prevention and a major loan with the Inter-American Development Bank. So data can be persuasive when you're able to demonstrate impact. The cancer costs are set to rise a lot because the burden is rising. And this is meant to show that the economic impact of NCDs is in all groups, working age, senior people, government, and community. When I did this slide last night, I thought, we tend to look at the older folk, but the children and adolescents of today with the obesity, we have to run obesity clinics. That costs money. And we have to deal with the addictions. The 12 to 16-year-old age group in all the surveys we have here, boys and girls, high levels of drinking and binge drinking, high percentage reporting. I had 3 or 4 or 5 drinks in the last week at one time. You must be drunk if you're 15 or 16 years old and you do that. You can't learn properly. So earning and learning potential is being impacted by some of these NCDs and the risks. And I therefore think the impact is on all the age spectrum, the whole age spectrum. Lost productivity, household poverty. As I said at the beginning, my sister passed from cancer last year and the family's left somewhat financially and emotionally drained. Even though you have insurance, the co-pays on them. So what do we need in terms of investment and some sort of vision for how this is tackled? I've tried to sum it up here. You need a comprehensive approach. It needs to be evidence-informed, appropriate to our setting. Public health prevention and control programs. It must take a multi-sector and partnership approach with the civil society, with the health ministry, and with the private sector. Has to be grounded in primary health care and in the community. And nowadays, we can technology enable things. People can get reminders for smears and medicines and other things that they need. And if you unpack what the public health approach is, that's that sort of second bullet. You need the surveillance for cancer. You must have your registry, the data, the policy to make the advocacy and get folks engaged, develop the guidelines. You need to strengthen regulatory capacity. If I might digress for a moment, on regulatory. I was shocked as a citizen a few years ago when I saw the results of a PAHO WHO survey that regulatory capacity in our Caribbean region on a scale of 0 to 100 was about 38%. And Central and South America were 90+%. As a citizen, I did not know that. Why is that? In very small jurisdictions, that regulatory capacity that comprises pharmacovigilance, registration of medicines, quality testing, it's just not there. So we've put in place now, with a grant from Bill and Melinda Gates, a central regulatory unit for the Caribbean, a CRS, with support from Pan American Health, and that is reviewing and recommending medicines for right across CARICOM. We have registered 18 medicines, including the new oral cholera vaccine for Haiti, which I'm really happy about, and it is ramping up now. Why is that further important? Well, you go to the OECS and you see very high mortality rates from cancer. Anybody here from OECS? A couple of folks. And you realize OECS pool procurement service is not buying some of these essential cancer medicines because they're pretty expensive. They're not registered so they're not accessible. So there's a need to get all the manufacturers together in the region and say, this is wrong. How do we get some break on these prices? How do we get some bulk procurement? So I focused on the strengthening of the regulatory environment for medicines, for food, tobacco, and alcohol are critical to deal with these epidemics that we have, and to get access to people, to medicines. That regulatory strengthening will do three things: increase access, bring down costs for governments, and it will make it easier for the industry. Sometimes things are available, but we're too small, so they don't bother the bigger, better players. The rest of it is there. You can see you need the staffing, you need the facilities. I've been talking about the medicines, and a concept of primary and secondary prevention, education, using social marketing. Why do women not come for cervical cancer smears? They don't know, the stigma, they're afraid. Can we get a sister-to-sister program going? Why do men not like to have prostate examinations, even though the jury's out on whether that evidence is really effective or not? We've got to improve surveillance and have the evidence for the policy and program planning. We're very pleased with the IARC regional hub at CARPHA, prevention and treatment services, especially for those that are highly preventable. HPV vaccines, some countries have introduced. That needs to be scaled up. The mapping of capacities, especially for the smaller countries, your treatment modalities, radiotherapy. The French have just undertaken quite an exercise in the Eastern Caribbean to map services and map expertise. And then the training that's needed. We have a lot of gaps especially with small countries. Palliative care and that's another sort of moral issue where we're not doing so well, and it's bound up again in regulatory issues around medicines. Availability of medicines, I spoke about this. I was pool procurement to reduce costs. There are a couple of mechanisms in the region. The OECS have a mechanism, and Pan American Health has 2 pool procurement mechanisms for vaccines and medicines. Winding up, thinking of the financing and putting it in this way. If you look at this chart, it's about how people pay for care, and when you're very young and when you're very old, you need help. And in the middle, you're supposed to be earning and saving. The problem is so many people are sick in the middle age that they're not earning and saving, they're actually dependent. And that's our economies weren't set up to do that. We're trying to persuade our ministers of finance and heads of social security to sit down and discuss the economic dimensions of this. Who's really bearing this cost? Where's the fiscal space to deal with it? Because we must. We can't afford to be hemorrhaging so much from preventable problems when the economies are struggling to grow. Various beneficial investments are available. Like Social Security, I'm meeting with them in June for the second time, the directors of Social Security, to talk about a partnership. Can they finance some prevention and for the region? They have no mandate for prevention. They can see that they're hemorrhaging because of the costs of these preventable problems, but they are not supposed to do anything. So we have to partner. We have mandate for prevention, we don't have money. Investment in social security systems, financing, more about financing, and maybe Greek to some people, but you have to have the financing to get the service that is needed. I've tried to, this is my last slide, I've tried to share with you something of the public health agenda with some focus on NCDs and cancer, and in our region how policy is set, both at national and regional level. And both are necessary in our small countries where we share so many things, information services, laboratory capacity, clinical capacity. Thank you very much.